Is Jennifer Robb?
My name is Jennifer Robb. I'm a clinician, advocate, and third generation of my family harmed by breast implants. My son, the fourth, his lifelong battle began in utero. Devin was born 32 weeks. My 4-pound baby boy was placed on a ventilator, fighting to survive. Besides respiratory complications, he had food intolerances, failure to thrive, allergies, eye infections, dermatitis, asthma, testing for cystic fibrosis. We both spent our lives in and out of hospitals, doctors, and specialists' office. We'd become dependent on the government to provide financial and medical assistance. I felt so helpless and frightened. Devin, please stand. Before you is the strongest, most courageous young man I am blessed to call my son. Ladies with BII, cancer, and all mothers with implants, please stand. Today I speak for the unaccounted, children left orphaned, decades of complaints globally, 19 reported deaths from BIA-LCL, lack of proper testing for those with systemic symptoms now and prior to established guidelines. Also, to remind you of the genetic variants thought to increase the risk of developing autoimmune diseases caused by silicone exposure. For us, the first casualty in our family was my grandmother, who died in 1993 after her disintegrated breast implants were removed. My mother's health wrecked for over 40 years with 3 different brands of breast implants. 3! In 1993, my breasts were augmented. A rupture went undetected for an unknown period of time, never picked up on imaging. Ultrasound reported floating debris in my implants. The texture shell was severely eroded and adherence to the chest wall, making proper removal impossible. Could mesh not do the same? I had symptoms of BIA-LCL, rashes, lung disease, weight loss, masses, enlarged lymph nodes, brown watery fluid in my chest, and the implant and blood tested positive for a rare fungus. However, the fluid was discarded and specimens never tested appropriately to rule out BIA-LCL. I was often misdiagnosed, did not return to my plastic surgeon, but instead had several life-threatening emergencies and hospitalizations, including a 3-week stent at Mayo Clinic, and Devin finding me unresponsive after being dismissed by an uninformed physician. It was 2 years after surgery. I had pleural effusions, pneumonia, infections, preterm birth, cardiac arrest, stroke. Masses began around the implant at 5 years, my first seroma at 8 years. By 24 years old, I had the first of many visits with a surgical oncologist for concerning breast issues and lists of specialists. Familiar with rare, I did not know I had Ehlers-Danlos syndrome, a rare connective tissue disorder, or the genetic variants thought to increase the risk of developing cancer or autoimmune diseases caused by silicone exposure. Please immediately recall textured breast implants, ban the manufacturing, production, distribution, and sale of all breast implants. Demand manufacturer accountability and action. How long does history have to repeat itself? How many lives have to be lost before action takes place? Isn't one life enough? Banning this lethal product is not to limit choice. I repeat, it is not to limit choice, but instead,
Ms. Rowland, please conclude. You're way over time.
Save lives, prevent disease, inspire the creation of new innovative ideas with healthier options. Is not the definition of insanity doing the same thing expecting different results. Thank you. I urge you to please listen to our plea.